it. Like we haven't even done the basics. Like if
Go
you're
spend your money on a massage.
yeah, and we haven't even done the basics. We're still not sleeping and still not pooping and
Exactly.
still not
There
eating
you
right.
go.
Like, who cares if you have
Yes.
mold in your system? It's not gonna like
Yes.
who cares, right?
Exactly.
I am surrounded by amazing women, and this week's episode is no different. This week, you're going to meet a triple threat guest. And in this episode of Medical Disruptor, I am talking to Andrea Nakayama. Andrea Nakayama is a triple threat. First, she disrupted medicine when her husband had an incurable diagnosis, and that's how she got into functional medicine. But then she realized that even functional medicine has its limitations, and she became a disruptor of functional medicine. And now she's taking it to the next level and really calling out the limitations of how we're doing wellness these days by doing something called narrative medicine. So, yeah, she's a triple threat, triple disruptor. I've never met one before. And she's basically telling everyone that we are not doing enough for our patients. And she's teaching patients and clinicians how to really do it better. By doing what? Actually listening to the patient. So you won't want to miss this. I'm Dr. E, the NP with a PhD. Let's talk to Andrea Nakayama. So, Andrea, I'm so excited to have you on the show. Thank you for being here.
I'm excited to be here with you.
But first, before we start, you have to tell everybody how to pronounce your name and why.
It's very inside baseball, but people ask me how to pronounce my name and I say it's Andrea, like mitochondria. So that's why we're laughing, because it's a great way for those of us in our space or in the science space to get it. But other people are like, what? What are you saying?
Oh, so you've tried it in the supermarket and that's just not the way to
Not
go?
in the supermarket, but on podcasts where they're not health people and they're like, I don't know what you're talking
What?
about. But for you and I, it's like, yeah, I got it now.
Oh my God, I love that so much. It's Andrea. Like I couldn't recover from that one for a while. So thanks for sharing that one. Amazing. So welcome to Medical Disruptor, where I introduce all my listeners to these amazing disruptors in the country because it makes us feel sane.
Totally.
And I would love one day where the things I have to say are actually not disruptive at all. That would be lovely. We're not there yet, though.
No.
So, um, I don't know, which way should we start? Should we start where you started? Tell us what you do now, then
Mm.
tell us how you got here.
Yeah. Okay. This is a long story. I'll do the cliff notes. So I am a functional medicine nutritionist, and I'm founder of the Functional Nutrition Alliance, where I train thousands of coaches and clinicians in the science and art of functional nutrition through my methodologies, which is very much about systems thinking and how we problem solve versus relying on protocols. Protocols being narrow, systems thinking allowing us to think more broadly, right? So that's where I spend a lot of my time. I have a team and a lot going on so that we're leading all those thousands of people through that 10-month curriculum. At the same time, my work is evolving to embrace more of the story. So I always say in functional nutrition and in functional medicine, we need to look at the story, the soup, which is the systems biology, and the skill. What is the person doing right now? What are they able to do? What's possible for them? And marrying all of that. Eventually, I realized that we were really still missing the story, the ATMs, the antecedents, the triggers, and the mediators. And that quest led me to the study of narrative medicine, which I'm now integrating with functional nutrition and functional medicine and ongoing conversations about aging, longevity, flipping it on its head, and how we embrace some of the aspects of lifestyle medicine that have gotten left behind in our quest for the quick fix. So I
Okay, hold
just
on.
said a lot.
Said a lot of things, and it's going to be above a lot of people's heads, and I don't want
Yes.
it to be.
No, thank you.
So I need everyone to come back in.
Yes.
And the way we're going to come back in is to take it back a second.
I
You
love
are like
backing it up.
100 steps ahead, and I don't think our audience even knows what ATMs are or anything like that.
Okay.
Before we even get there,
Let's do it.
tell us you were just like a regular human being before life hit you in the face.
Yes, thank you for bringing me back. I get into my passion and know you're my people. And so I'm
No, I'm
speaking
with
to
you. I'm with
you, but
you.
I'm so glad you're bringing me back to everybody listening. That's so important. So, yes, I was a regular human. I am a regular human. I was a regular human who was living my life with my soulmate, Isamu, and we got pregnant, which we had been trying to do, which was very exciting. It was in our early 30s. And 7 weeks into my pregnancy, he very suddenly was diagnosed with a stage 4, very aggressive brain tumor called a glioblastoma multiforme. So before we had told anybody that we were even pregnant, we were
Mm,
having to announce that he had this brain tumor and was given a prognosis of about 6 months to
Jesus.
live. So we can do the math there. We can all do the math. He was given 6 months to live. I was 7 weeks pregnant. He was not expected to see our baby born. He, in fact, lived almost 2.5 years. So he
Wow.
died when our son was 19 months old. I
Mm.
was telling you that son's now 24. So this is a long time ago. I can talk about it, very easily as part of my life journey. But that experience, and I think this is important, that experience led me to see some of the gaps in our conventional medical model.
And I love that, and I want you to continue, but I that is exactly what brought me, right? I was in medicine. You weren't in medicine. I was in medicine, and I really thought I knew what the heck I was doing until my wife got sick. And that is
Yes,
when you push the boundaries because we tend not to do that for ourselves, but for someone we
right.
love, there's no holding us back. So what did you experience? What was limiting? And then what did you just like, how did you break through? What did you break through?
Yeah, so that was a journey. And I will say, prior to his diagnosis, I was starting to feel things in my own body that I
Mm,
was trying to control through food. Those were the beginnings of my own autoimmunity, and I didn't know it then. I
yes.
wasn't in the field. I worked in book publishing. I was in a completely different field, but I would notice if I eat this, this happens. If I don't eat that. So I was already playing with food. We lived in the Bay Area. I was like, I loved going to the farmer's market and cooking. So when Isamu was diagnosed, I turned my attention to what I could do. What research could I look at? What could I do? And there wasn't, this is 2000. The internet was not what it is today. The
Mhm.
books on lifestyle
No,
interventions, dietary and lifestyle modifications did not exist.
I did not.
I was reading Choices in Healing by Michael Lerner. I was reading Andrew Weil. Like that's what was available to me. And I would bring that to Isamu, who was, part Japanese, very stoic, and he was doing the medical research to consider what trials to do. And I would say, look, I'm looking at this connection between sugar and cancer growth. What
What?
do you
Not
think? Right?
connected. That's
So
outrageous.
that was my start and kind of my boot camp. At the same time, I was seeing those gaps in the medical model. And when I say that, I want to say the medical system that he was in the top area for dealing with
That's
a
the
brain
best.
tumor at UCSF. They were amazing, but there was a lot that wasn't being discussed. There was a lot of room, and I saw every person with the same diagnosis is treated the same,
Fed the
and
same.
everybody's treated like their diagnosis.
They're
And
treated
those
like
were
their
the
diagnosis.
first two gaps. Yeah,
Oh, wow. So treated the same and treated like their diagnosis. In other words, it didn't matter what he had going on in his life. His glioblastoma, this is what's happening for this. It's not how do we get here, right? Oh my God, that's so funny that you said it that way. I never said it that way. Obviously, this is how I practice, but I never said it that way because one person's Hashimoto is very different from the other person's
correct.
Hashimoto.
Absolutely.
And you could treat the Hashimoto, but if one person is gluten sensitive and the other person's like mold sensitive, like you're not going to do
Exactly.
it. Oh, that's like such an earth-shattering sentence. This is why I love podcasting because I get to meet amazing humans like you.
Oh,
Um, okay, so then you realize that, and also I imagine that back then, I mean, we had a similar experience. Like, even if you brought in some of your crazy sugar cancer stuff, you're actually like laughed at or disregarded.
Well, the beauty of what we were doing is we weren't looking for approval
Good.
anywhere. And I think that this is a really important message that patients need because we have to be our own advocates without playing a role or being in a scope we're not. So I like to remind patients that there's a lot of time between their doctor's visits. We're not asking our doctors which toilet paper to buy or which toothpaste to buy. We don't need to ask them about something that's outside of their scope. And dietary and lifestyle modification and understanding is outside of most doctors' scope. So if you have
Ah.
Crohn's disease and you ask your doctor, does my diet matter? They could very well say no when that's an obvious connection. If you're going through menopausal symptoms and you say, does my diet or lifestyle matter? They could very well say no or go on a diet, right? They're not understanding. It's out of their scope, and we're asking for their approval when we don't need their
I
approval.
love that. I love that approach, how you frame that. I do a whole speech and I'm writing my second book on medical gaslighting. And really, the gaslighting is the fact that they only have one tool and they think their tool is correct. But
Yes,
the empowerment comes from us understanding that
correct.
they just have this one tool. So, so well phrased and like, well, don't ask them about that. They have no idea. They never learned about nutrition
No,
and disease. So
yeah,
you're just going in for a conflict. Right?
yes,
You go to them for their tools. If it's chemo, if it's radiation, this is what they're great at. I don't know anything about chemo radiation.
correct.
Um, and if you need to set a bone, if you need antibiotics, go to them for their tools.
Yes,
But for the other stuff, you would not ask the electrician's opinion on your plumbing.
correct. That is absolutely right.
And I love that idea of like there's so much time in between. So are you
Yes,
just gonna like so much you could do? And then, yeah, that is so well said. Thank you for framing it that way.
yeah.
So what was for your husband, what was the thing that prolonged his life? What was the change?
I think it's hard to say. I mean, I might today say, like, everything is connected. We're all unique. All things matter. That's my mantra for everything. Lunch matters, sleep matters. He definitely transformed as a human. He stepped back from work. He'd carry around the Bhagavad Gita. He was really coming into a different place of meditation and movement and thinking about life. He became a father.
Ooh,
He had time with love. Like we were just in this like bubble of love and gratitude for the time we spent. We ultimately were together 10 years, but there was so much preciousness in our love during that time that we were in something together. There was nothing in opposition. Who took out the trash didn't matter because we were in the blessing of what was happening. He
wow.
loved being a father. So I think joy, belonging, all of those things, I would say, in addition to the low sugar, Mediterranean, pesca vegan, plant-based,
It's so
meditation,
funny.
yoga.
Would you say that for me, I would say that as I evolved as a practitioner, I imagine on that understanding comes later, right? Because you start function like, all right, I gotta get the sugar out, and that all that's important. But that extra piece, it came to me much later as a practitioner. Like if we don't have that piece, we don't have the whole part of it. Did that come to you later, or did it come fast to you because of what you experienced?
No, I think it did come later because I think we have a culture that's very much protocol centric. And even if we're anti-protocol, we're like, what's the thing? What's the test? What's the wearable? And the work I'm doing now with the narrative medicine, like the
Mm.
article I'm writing right now and the book I'm working on, the article I'm writing now is about the healing power of belonging. Where does belonging
Oh,
support our reduction of inflammation, the genes that turn on inflammation and turn off inflammation, oxytocin production? Like there are so many things that
oh, I love
contribute
it.
to health, healing, and longevity that we're leaving on the table in favor of the fix for our telomeres or whatever we want to,
Yeah.
fixate on that's getting fed to us all the time.
All the time. So am I hearing your story arc correctly, my ex-publisher?
No,
Um,
I love it.
am I hearing the arc where it sounds like, well, not exactly patient, but patient advocate, patient, also your own autoimmunity, to eventually clinician,
Yes.
to now teaching other clinicians,
Yes.
but now circling back and revisiting how you are a clinician in this
Yes.
narrative medicine. Oh, I
Yes.
love this. But we
Beautiful.
have to tackle all of
Yes.
this. We're good, but we're gonna
Yes.
go slow because
Yes.
I wanna unpack this. This is so good. Okay, I like and knowing that I know the macro and understand where we're going is helpful to me, and I imagine to our audience.
Love that.
So you were this, advocate for one,
Hmm.
and he passed, and I'm so sorry for your
Thank
loss.
you.
But obviously he was also that journey had to happen for you to have
Correct.
helped so many
He
humans.
is in everything I do.
Oh my God, I love that so much. Oh, you make me think of my wife.
Hmm.
Um, and she's with us, but I think about
Yes.
her all the time
Yes.
because I
Yes.
mention her at every book and
I
every lecture.
love that.
She is the reason for where I am today for so many reasons. Um, so then you decide to become a clinician.
Yes.
Okay, so you go to school and then so I imagine that you started like all of us. It was like, well, there you start with protocols,
Sort of. I
sort
think I
of.
was always thinking differently. And I do think that not coming from the healthcare space helped me. Coming
Ah,
from a
interesting.
publishing, editorial, creative space, I have a BFA, I have a Bachelor of Fine Arts in art and design, right? So I think my ability to think in an arc, to see a broader picture, to poke holes in thinking comes from a background that wasn't
Love
very
that.
linear. And so um, I started going back to school to get all my post-bac, pre-med, prereqs to go to an RD program. I just want to say I'm working full-time and a single mom at this
No
point. So
stress. So
no
nothing that won't
stress,
impact your health at all.
not at all. That Hashimoto's,
No, it's
no
gonna be
connection.
fun. All good. I love this so much.
So that was the first journey. And then I got into the one registered dietitian program I would consider going to. I got in with all my post-bac, pre-med, prereqs, which I had to do because I had a
Right.
BFA. And I couldn't bring myself to move my kid out of his community and his
Environment.
environment, which is what it would take. And so I started creating an unconventional path of learning and getting the credentials to just start something slow
Start
and
something.
steady. Yeah. And that ultimately, I have my master's in human nutrition and functional medicine, but like I started my practice before all that and was seeing results, like incredible results by staying in a scope that's missing in our system. And it wasn't by trying to be in your scope, which is not my scope. I do not
Right.
diagnose, I do not prescribe, I do not treat. I assess, I recommend, I track, I repeat. And so I think there's a missing scope for people with chronic illness that I was filling, and that's why it was garnering attention from both patients, but
Yeah.
also from
I
people
mean,
who wanted to learn why I was having such great results.
absolutely. I mean, you brought 2 points here that I just want to surface. Like the first, I think you bring a new dimension, which we've not had before, the dimension of not coming from medicine first. I've had
Yes.
some people who are not medical at all, but like moms of or rights, but like one fierce warrior is a mom of a child.
Love that.
So there's different ways,
And
but
there's a lot of those people in my curriculum because they
yeah,
want to
who are
then bring it
warriors.
forward.
Yeah,
Yes.
absolutely. But you brought a nice perspective dimension that when someone like me has to unlearn, and a lot of people in Institute of Functional
Yes.
Medicine,
Yes.
we have to unlearn,
Yes.
but we then go linear. We're still linear. We replace a different A for a different B, and it takes us time to undo that. It took me a long time to undo that, to get to more undulating comfortability, right? where you brought that undulating comfortability, that heart rate variability into it
Yes.
right from the start. Very interesting perspective, and probably catapulted you in many ways that other people would have to unlearn.
I just
Any
want to
other?
respond to that, Dr.
Yeah,
E,
please, please.
because where functional medicine has gone, like what attracted me to functional medicine and what really aligned with the way I was thinking, and I realized there was like an allegiance there. I was doing it before I had the functional medicine understanding.
Yes,
When I
yes.
found functional medicine, I was like, oh, yes, therapeutic partnership, systems biology, root cause resolution. This is what I'm doing, right?
Yeah,
But what's happened with functional medicine in my 20 years in the field has become so much of what you're talking about
yes,
in terms of that very linear thinking that it's a disservice to, I'm going to say the founding fathers because they were founding fathers, but like what that whole system was really originated to be is getting lost in our expensive testing that doesn't actually have all the evidence we need, all the supplements, the dietary theory. It's become very linear and very noisy in
yes,
a seductive and expensive and exclusive way that I feel really frustrated with, which is what brought me back to that story piece. It's two things happening the same time
yeah.
that
You know
led
what?
me back.
Let's explore that. I agree with you wholeheartedly. It's one of the reasons I left one to one. And I just spend my time either in other ventures, but in this space, I'm just talking like
Yeah.
this and
Yes.
sharing. There's no CTAs, there's no selling anything. And That's really interesting that you brought that up. And it's like who do you, on the one hand, you could say it's industry driven, but on the other hand, it's also really much consumer driven,
Absolutely.
right? Because the type of patient that you need to really do this work has to understand the time involved, the self accountability, and the slow changes and the daily habits. It's not 30, 60, 90-day regimen protocol. It's not,
Correct.
well, what supplement line should I take? Supplement,
Correct.
like I mean, they're okay. I take them, but
Yeah,
they're
me too.
10% of the game.
Yeah.
If that much. I'm still
Yes.
okay if I skip it.
Yeah.
Um, and a lot of consumers are frustrated by that process. And they're like, well, what do you mean? When I call this guy and in 30 days, and when I talk to the guy at the gym, right? So it's consumer driven as well, isn't it?
Yeah, it's why I have a really big issue with the word wellness because wellness is a consumer-driven industry that is feeding a story and a storyline and a narrative that we all want to hear. We are inclined to go for the quick fix. And so much is sharing with us that we can have a quick fix. The people
Yeah,
I see and work with for my book are on the other side of that spectrum where they've done the 30, the 60, the 90, they've done the 2 years.
yes,
They
they've
have
already done
stacks
that.
of labs. They've taken every supplement. They've been on the most restrictive diets and they are angry because they're not better. And the gaslighting didn't just come from their conventional docs.
Agreed.
The gaslighting came from their functional docs who put them through a lens that was about their biases and ideologies. I see, and I've seen, and I'm sure you've seen this too, that there becomes a diagnosis du jour, whether it's adrenal fatigue or SIBO or whatever, mold, whatever we're, and I'm not saying those things aren't real, just like I'm not saying labs aren't good or
Sure,
supplements aren't
sure.
good. It's just a yes and that needs to be seen through a broader and individualized lens. And this whole notion that everybody needs to take this stack of tests and be on these supplements and this diet completely ignores the reality of that individual and is another form of gaslighting. And that's who I
Yeah,
see that I'm speaking to. I see you, I hear
I
you.
love this.
There's another way in.
I love this. I'm going to say one more thing and then I want to jump into your narrative thing because I want to make sure people know kind of the difference and why you need to come back to this, right?
Yeah.
Because for
Yeah.
you and for I think it's obvious, right? And maybe
Right.
I'm oversimplifying this audience. I'm sorry. I just want to make sure we don't lose anyone.
Yeah. No, I'm glad.
Um,
You know your audience. That's
so, I, so for me, like when I first started, because I came from a land, so I was like, I tested first, and I also needed to prove it myself because I also came from a place of like, I don't want anyone to say this is quackery, right? This is
right.
everything has to be rigorous, rigorous, rigorous.
Right.
So I had to let go of that. So as I got better, I stopped doing the testing.
Yes.
I saved the testing for when I hit a wall, and I was like,
There
maybe
you go.
it's time
Bingo.
to, yeah, right? Maybe it's time to
Bingo.
explore.
Yeah.
But then a lot of the consumers were like, where are all the tests? And I'm like, you don't
Exactly.
need it. Like, we don't
Yeah.
need, we haven't even done the basics. Like, if
Go
you're
spend your
still,
money on a massage.
yeah, and we haven't even done the basics. Like, if we're still not sleeping and still not pooping and still
Exactly.
not
There
eating
you
right, like,
go.
who cares if you have
Yes.
mold in your system? It's not gonna, like,
Yes.
who cares, right?
Exactly.
So as you get savvy with that, but I think all our audience knows if they're listening to this podcast, they're bombarded every time with this test and that test and
Yes.
test your hair and test your urine
Yeah.
and
Oh
test
my
your breath and it says everything.
God.
And I imagine you agree with me that even before we get to the nutrition, what happened to your dysregulated, nervous system.
Yes.
So you did all that, and then you started training people.
Yes.
What did you train them on? Because you started this training before starting this narrative thing.
Yes.
Okay, so
Yeah.
what are you training them
Yeah.
on?
So I'm a real systems thinker, and I'm going to share some of my systems because they're easy for anybody to understand. But
Yeah.
I also just want to say that the basis of what I'm teaching practitioners is anatomy and physiology through the lens of diet and lifestyle modification. So,
Mm.
lifestyle medicine, how do we understand the body and what should be happening in the body so we can be better detectives? So, even I have a lot of nurses that go through my training and they're like, I
Wow.
thought the anatomy and physiology was going to be a repeat, but you're teaching
No.
it in a way because they don't learn where the
No.
factors of life, the story, or the factors of life choices impact our physiological function. So
Can you give an
that
example?
is, yes, if I talk about the microbiome, right? So we all are flooded with the microbiome, take seed, take this probiotic, whatever it is, we can look at so many different things that impact the microbiome. Those that are very well known now, like how you were born, what order you were born in, how you were born, meaning vaginal or cesarean, what order you were born in, whether you took antibiotics in childhood. I got to know that about a person before I start
Okay.
just like throwing microbiome stuff at them. I also need to know, as you said, are they sleeping? Are they pooping? What are they eating? What's that makeup of the food they're eating? Is their blood sugar balance? My non-negotiable trifecta: sleep, poop, blood sugar balance. Those aren't in order. We ain't going anywhere yet. I don't
No,
need a test.
nowhere.
I don't need a test. I need to make sure we are ready to need a test. And I'm
Sure.
only going to test, like you said beautifully, if clinically I need more information. If I don't need more information, I've got the qualitative data
Mm.
that I need to continue to move forward. So, microbiome as an example. Let me give another example:
Please.
hormones.
Mm.
Hormones, somebody's going through menopause, or they have fertility issues, or they have really painful periods. I have to look at the hierarchy of understanding the anatomy and physiology of hormones and hormone production in order to help that person and see if we have to do more. Right? We don't want to go right for the fix for what I call the branch. And I'll share that 3 roots, many branches model with you as an example. But what I want to do is really come down to the basics. So I think of hormones in a pyramid. At the base is blood sugar, one of my non-negotiables. Then I have insulin. then cortisol, then thyroid, then sex hormones. If I'm trying to address sex hormones without understanding those other pieces are in place, I'm building on quicksand. At the same time, from my perspective, when I'm looking at hormones, and when I say from my perspective, I mean my scope, because I don't diagnose, prescribe, or treat, I'm looking at hormone metabolism as opposed to just hormone output. So I want to see, are you sleeping? Are you pooping? Or is your blood sugar balance keeps coming back to the same factors in order to help you address your hormone dysfunction, as opposed to taking a top-down
Yeah.
approach, which happens in conventional medicine and in functional medicine.
Yes. I'm thinking immediately. I know where many of our audience is thinking like a menopausal woman, but I'm immediately thinking of my PCOS woman who's coming in on birth control.
Correct.
What have we done? What
Yes,
have we done? We've done nothing besides provide
exactly.
birth control, which if you need birth control, fine. But we've done nothing. And how many women, because I still have a primary care practice, come in diagnosed, relieved with a diagnosis of PCOS, and not understanding, and no one's ever explained to them that they're insulin resistant and pre-diabetic. What do you
Yeah,
mean? My A1C is fine. Um, so, so I'm listening to you and this top-down approach. Um, but on the subject of hormones, I'm gonna take a moment here. I just want to
yeah,
ask your opinion
yeah,
here. Postmenopausal women, there's no question that sex hormones are part of the problem. But
absolutely.
are you saying that you would not suggest that they get HRT unless those other things are addressed? As always, thank you for tuning into the Medical Disruptor. If today's conversation sparks something in you, grab a copy of my book. It's a great way to start, or you can get free access to my video library at drfatlamandre.com/courses. And if you're a nurse practitioner looking for courses to level up your clinical confidence, visit my website at egprep.com. Don't forget to subscribe, share this episode, and leave a review. It helps us reach more disruptors like you. Until next time, keep questioning, keep learning, and keep disrupting.